Thank you, and thank you, Celia. And I'm pretty proud because I realize that at the moment women come in the play, it starts to be emotional. It's no more technical, but it's emotional. Okay, thank you. So it's true, we have the old trends with patient-doctor relationship. We have this idea of a family doctor, and this family doctor should have a lot of social skills. When you're talking about family doctor, you're talking about somebody you can visit anytime and who is always open for you. Cecile was a lot talking about compassionate, and another very important thing is when the people think about family doctor, they always think about continuity. And what I want to say is it's not the fact anymore today, and it's not about technology. It's about change in the society. Imagine continuity. Now, most of the doctors are women, like Cecile and I, and most of the doctors say, hey, it's important to have a great work, to have something else in my life. I would like to work part-time. So how is it possible to have continuity when you have a group praxis, and every time you visit the doctor, you have somebody else visiting? So what I want to say is that in this patient-doctor relationship, the change are not only technological, there are a lot of societal change, and this is really important. Everybody talk about patient-centric care, but the patient-centric care is not a technological issue. It's a change in society who started 20 years ago, who has nothing to do with Google, who have nothing to do with technology. It has to do with patients who decide that they don't want to be treated like this anymore. They don't decide, I go to internet and pick a lot of information. So what is really important is that technology is a part of the change, but the most change comes from the society itself and had really nothing to do with technology. And when we're talking about patient-centric care, it's true, we imagine a patient alone, but it's not really like this, because patient-centric care, there is a whole ecosystem around this patient, and we could talk about the technological ecosystem, we could talk about the health system itself. What I want to talk a little bit about is who are these persons surrounding my patients, and what is the impact of the technology on the relationship? Because when we're talking about medicine, we always talk about patient-doctor. But as a medical doctor, between me and my patient, there is always a nurse. So what is the patient-doctor relationship, and how can the situation be patient-centric from my point of view when I always have somebody between me and the patient? So most of the time I say it's a patient-nurse-centric system from my point of view. So now with technology, it has really bring a change, it has bring a big change. Who is the expert? Because before, when I have a problem, and yesterday somebody came to me and said, oh, I have a problem in my shoulder, I was visiting 4 doctors and I have 4 different diagnostics. Is it possible? And I was answering the person, yes, it's possible, because you are not visiting the right expert. Because in this case, it's not a doctor problem. I was saying, go to the physical therapist, and then it will finish. So now we have to change our minds and stop thinking that the doctor is the main important person. Just take a few examples. This is an example. Our company is dealing with a chronic wound, and we are empowering nurses when they are treating chronic wound. And what happens is that the nurse is visiting the patient. She will collect wound data, and these data are automatically analyzed. And then at the end of the consultation, she will send to the doctor the information. So the relationship between the nurse and the doctor is completely shifting. It means now she is the expert. She is feeding the doctor with information. And what is the impact of this on the patient-doctor relationship when in between I have a new expert? Good question. Take another example. We are talking about change in society. Let's take the example of obesity. This example is the dietitian from Canada. They are doing really fantastic digital work. They have 2 or 3 internet websites. They have 3 or 4 mobile applications. It's about taking a picture of what I'm eating. It's about measuring my activity and all of these things. But what is the consequence? If I'm an obese patient and I'm visiting my doctor every month, every 3, 4, 6 months, who is my partner in this? When the dietitian is following me every day, when the dietitian is in my pocket, when I have a problem, do I ask my doctor? Maybe, but it's probably that between the doctor and me, there is somebody else, and somebody really important, like the dietitian. I take another example, and it's about patients suffering after limb amputation, and they have the so-called phantom pain. So before, to treat with this phantom pain, you have to visit a physical therapist, and they were using mirror. So because you cannot see your limb anymore, and it's really important to have an image of your limb to be able to treat this pain. And now the physiotherapists, they have by their own, without the doctor, they have developed an application that enables the patient home to do the same job. So now the patients are exercising every day. But it's not only about exercising every day. They are every day connected to the physiotherapist. So if this person has a problem, who is the expert? And what is the impact on the patient-doctor relationship when in between I always have another expert? So you see that when we're talking about patient-centric care, we realize that you have a patient, it's true, we have a doctor, it's also true, but we have a lot of other professionals, and using digital technology, all these professionals are completely empowered. And there is another group we never talk about in an aging society, and this group are caregiver and relative. And there are a few studies running around how can caregiver use digital technology. This is an example of how we can, with smartwatch and an application, follow patients suffering from Alzheimer, because by this patient, what is interesting is to limitate the area where they go, and sometimes they forget it, and we lose this person. So now, without this technology, we have to keep and to block the area to be sure that they don't get lost. But now, using this kind of technology, we are able to let them free, and if we are looking for them, we can find them directly on the map. So in France, they have been doing a really interesting study about what is the impact of the digital technology, or what is the interest of the digital technology for caregiver and relatives. And what is really important is for relatives, they consider that this technology is not replacing. And we heard Cecil also, another person, talking about this. When we talk about technology, it's not about replacing the human support, but it's a complementary. And we were asking these people, but what is the impact for you as caregiver and relative when you use this digital technology? And for sure they say, okay, I can sleep better because I know that my mother, my father, my sister is protected. And they say, okay, I can travel. Because if you have a parent who's suffering from Alzheimer, most of the time you cannot go on holiday. So they say it gives me a lot of liberty. But the most important point, they say, I get information. I know what's going on because I can monitor my relative. And now we can ask us, what is the impact on the patient-doctor relationship? Because if you have a relative suffering from Alzheimer, you go with this patient to visit the doctor. But now, when you sit on the consultation, you are informed. You're not waiting and not saying, doctor, what is about my mother? Now you are the expert and you say, doctor, my mother was doing this and this and that. So what is the impact on the patient-doctor relationship? And what is my last point is when we say it's a patient-centric care, we have a patient alone. Patient is alone, he's the center of something, and everything is around. But I was working a lot in this medical call center, and one of most activity was to advise people who were measuring their blood pressure, because monitoring patient is a long story. It's nothing new. It's not about digital medicine. But a lot of people have a blood pressure curve at home, and they measure, and all people, they measure it very regularly. But the problem is when it's out of the range, they don't know how to do. So they were calling us to say, hey, I was measuring, what should I do? So when we always have this idea of patient-centric care, it means we are accepting, we isolate our patient. And then you have a patient who have a lot of device, who can quantify himself, who has a lot of information, but how can a patient deal with all this information? And this, I think, is a really important point we have to consider. It's the reason why I don't used to talk about patient-centric care. Thanks a lot.